Hi, I'm Dr. Mobell. I'm a family physician who taught residents and medical students in the hospital and the office for 30 years. Now I teach public health at the University of Arizona College of Medicine, Phoenix, and work in a small clinic where many of my patients do not have health insurance. I'm here to talk about how our healthcare system is badly broken and what we can do to fix it this year. Now, if you have good insurance and you can afford your out-of-pocket expenses, our healthcare system can be the best. We have innovative, cutting-edge care, great cancer care, great heart attack care. But the problem with it is our costs are out of control. We have expensive premiums, medications cost a fortune, out-of-pocket costs are sky high. Plus, we have poor health outcomes. The average life expectancy in America is much lower than other wealthy countries, and unfortunately, it's decreasing. 32 million Americans had no health insurance before the coronavirus hit. So this system really is broken. Well, what do the other wealthy countries have that we don't? A lot of people think it's government-run healthcare, but that is not the answer. What they all have is everyone has health insurance coverage. Different countries do it in different ways, but everyone is included. Now, why is that so important? Well, it's the same reason everyone needs car insurance. If you get hit by someone who has no insurance, who's going to pay for it? All the people have insurance. It's the same with medical care. When people without insurance get sick or hurt, go to the emergency room, get admitted to the hospital, who pays the many millions of dollars for their health care? It's you and me, with higher insurance premiums, deductibles, and copays. So what is our healthcare system? I describe it as a confusing mix of private and government plans. Private insurance includes employer-based insurance, the Affordable Care Act exchange, also known as Obamacare, the government single-payer plans like Medicare for elderly patients, Medicaid for poor patients and people between jobs. We have government-owned and operated systems, the military, the VA, the Indian Health Service. And unfortunately, we have many millions who've got nothing. They are uninsured. And it's very expensive. We pay over $11,000 per person per year. That's 18% of all money spent in the US. And it's at least twice as much as other countries spend. So I think it's important to think about what was the system like before the Affordable Care Act? Well, 6 out of 10 Americans had employer-based health insurance. And that worked pretty well, except there were some big problems. If you changed jobs, your pre-existing conditions were not covered. My wife had breast cancer, and I could not change my job because if her cancer came back, her care would not be covered by any new insurance I got. There were lifetime limits. If you used up all the money, you were out of luck. And insurance companies looked for loopholes to kick people off insurance when they got sick. But there were people who made millions of dollars in bonuses by finding thousands of people who got sick, really needed care, but got them kicked off their insurance so the companies saved money. Unbelievable. Also, small employers could not afford to offer health insurance. And 50 million Americans, 1 out of 6, had no health insurance at all. These folks use emergency rooms more. They died and got disabled more. Their medical bills caused lots of bankruptcies. Their healthcare cost billions of dollars, and we paid for it with higher insurance premiums and taxes. So what were the goals of the Affordable Care Act? Well, the first one was to get more Americans covered. It made the insurance mandatory with a penalty if you were uninsured. It tried to make it affordable for small businesses and self-employed people with tax credits and subsidies. But a huge thing that it did, and I think this was not talked about enough, is it fixed the insurance industry. Pre-existing conditions are now covered by law. There are no lifetime limits, no more kicking people off for technicalities. Basic coverage like prevention, vaccines, birth control, drugs, and mental health benefits were covered. And it did not mess with employer-based insurance for those people who are happy with it. And this is something we didn't talk about either. It did not increase the federal deficit. It would cost money to cover more people and cover pre-existing conditions. It was going to cost about close to $1 trillion, if you remember that, over about 10 years. But it was paid for by increasing taxes on the richest Americans and by saving some money. And it started to control cost. It created health insurance exchanges so people could cost shop, cost compare. There was competition and ideally better pricing. So that were the goals. So what did it actually do? Well, it did get more people covered. The insurance exchanges got 12 million people on insurance who worked for small employers or were self-employed. It expanded Medicaid. 11 million people got covered in 37 states. It made health insurance mandatory. So that uninsured number dropped from 50 million to 27 million. It also reformed the insurance industry. Pre-existing conditions are now covered by law. You could stay on your parents' insurance till age 26. That was great for me. Both my kids stayed on it till they were 26 years old. And you can no longer be kicked off your insurance for a technicality by law. So what's happened to the Affordable Care Act? Well, unfortunately, over the past 4 years, the current administration has really gutted it. First, they tried to repeal it completely many times, but subsidies to insurance companies have been cut. The individual mandate penalty has been eliminated. So lots of healthy people are opting out of insurance. People are getting insurance after they get sick, which costs the rest of us lots of money. Funds for healthcare.gov signups have been cut, so fewer people are enrolling. Pre-existing conditions are covered, which is great, but that's expensive. So what's happened? Well, premiums have skyrocketed because of attempts to gut the Affordable Care Act. And 5 million people have lost health insurance over the past 4 years. The important question is, though, what should we do now? And I think it's a good place to start is, what do other countries do so successfully? There's several models out there. Well, one of them is the United Kingdom. They have a national health service. It's government owned and run like our VA. All residents are covered. It's free, paid for by general taxes. All patients have to have a general practitioner. The National Institute decides what treatments and drugs are covered. And about 11% of British people have private insurance for faster elective procedures. This works well in the United Kingdom. It would never work here. We're too big. People don't trust government to run and own all their health care. So no one's really talking about this. But what they are talking about is a system like Canada, the national health insurance system, a single payer. This would be Medicare for all, pays for private practices. The Canadian Health Act decides what treatments and drugs are covered. 2/3 of Canadians have private insurance for private hospital rooms, drugs, rehab, home health care, dental care, and optometry. But the models that people don't know as much about, I'd like to stress, 2 countries. Germany is one. They have legally required health insurance. There's 120 competing public nonprofit insurance companies. It's paid for by both employers and workers. There's no deductible, low copays, children are free, and almost everything's covered. Dental, medical, optometry, drugs, physical therapy. And how cool is this? Drug prices are set by the government. Now, the wealthiest 10% of Germans have private insurance for, again, a little bit quicker care, maybe a little nicer facilities. The Netherlands is another country with, I think, a very interesting system. Again, universally required health insurance. They have a national health insurance exchange where people can go online and pick which insurance company they want. Benefit packages set by law. The government helps low-income residents afford it. It's funded by insurance premiums and taxes. There's no copay to see a general practitioner or for children. There's an annual deductible, but that covers pretty much all of your costs. And most people in the Netherlands have extra insurance for things like dental care, physical therapy, and eyeglasses. So what should we do now? Well, there's really three options I think being discussed. The first is the current administration would like to repeal the Affordable Care Act to see what happens. Well, I think for sure we'd have no universal health care coverage. We're gonna have a lot more uninsured people, which is gonna lead to higher premiums and deductibles. Pre-existing coverage protection is clearly at risk. Nothing's going to address our poor outcomes. And they haven't talked about how we're going to pay for it, but probably health savings accounts and high deductible health plans. Well, the second plan, especially this spring that was talked about a lot by Bernie Sanders and Elizabeth Warren, was Medicare for all. People do like Medicare. Everyone would be covered. We'd have one system. There's a lot of benefits to this, but there's some problems. If Medicare gets too big, is it going to work efficiently? And more importantly, how are we going to pay for it? The estimate is it will cost $32 trillion over the next 10 years. Well, the current federal budget is about $4 trillion a year. So this would add $3 trillion to that. I don't think we can afford it. But there's a third option that I think could be really good. And that's to fix and improve the Affordable Care Act. Take the best ideas from countries like Germany and the Netherlands and make it better. We have to mandate insurance, but we can increase choice. We can expand Medicaid in all 50 states. We can have a robust insurance exchange for competition, price control, innovation. That's capitalism at its best. We have to subsidize low-income people, have some required basic covered items, and that way we can keep deductibles and copays low. We also could add a public health insurance option. That's been talked about. That would be to allow working age adults to buy Medicare or Medicaid, or maybe a new plan run by the government. Now, doing a government-run option with generous subsidies to help people buy insurance would cost just over $1 trillion over the next 10 years. This we can afford. All legal citizens would be covered. We can do this. We can fix our system. So this fall, we've got a choice this year. We could keep the status quo, repeal the Affordable Care Act, see what happens. We can think about Medicare for all, but I think, and my bias obviously is, we should improve the Affordable Care Act, make it work better, take great ideas from countries like Germany and the Netherlands, and fix our system. This winter, it snowed 6 inches in the desert just above my home in Phoenix. I went out hiking in it. And I tell you, if it can snow in the desert, I know we can fix healthcare in the United States.